Like any orthopedic condition, there are many treatment options, and you really have to choose what's best for the patient. Now, I'd like to say that surgery for the frozen shoulder in my hands is actually quite rare. Perhaps less than 5% of the patients that come to me to have a opinion regarding a frozen shoulder end up having surgery. And as you appreciate, I only see the tip of the iceberg because there are plenty of people in the community that have frozen shoulder that don't need treatment. So that's how we start, right? So a lot of times, frozen shoulder does not require treatment as long as the pain and stiffness is manageable. Once the patient has a diagnosis, you can live with it because in most cases, given enough time, the stiffness improves, although not completely in most cases, and then the pain certainly settles down. So that's how we start about treatment, i.e. we don't treat frozen shoulder. We just tell the patients they have it, and some of them are quite happy to live with it. But there is obviously other things as well. On top of the thing is physiotherapy, including hydrotherapy, which is very good for frozen shoulders. You can treat frozen shoulder pain with analgesia, so you can manage it. And then when it comes to a bit more treatment-wise, we start thinking about patients that are unable to have their non-operative treatment or more conservative treatment, and we offer them certain kinds of injections. So that's how we start. So most patients that have come to see me, unfortunately, as I said, at the tip of the icebergs, they have already tried some conservative means. I've given them a diagnosis of frozen shoulder, and they usually want some treatment done. So we start with injections, and the commonest injections that we give is an injection called a hydrodilatation. And what does that mean is we inject the shoulder, but instead of using a really tiny volume, we use a high volume injection. So the injection effectively goes in while the patient is awake with no sedation, no analgesia, so completely outpatient procedure. And you inject the shoulder with a little bit of local anesthetic, a little bit of cortisone, a steroid, and a lot of salt water, i.e. saline. And what you effectively do is go in and you stretch the lining of the shoulder, which is quite stiff. And there are plenty of studies that show that just a simple procedure like that can significantly improve the pain and significantly improve the range of motion as well. But there are, of course, some patients that even that is not enough. And with those patients, we tend to do surgical intervention. It is, like I said, quite rare in my practice. But surgery is actually relatively straightforward. It's an arthroscopic capsular release, i.e. you're going in, keyhole surgery, making 2 tiny holes in the shoulder, and going with small cameras and small probes and releasing all the scar tissue in the capsule of the frozen shoulder to give them the range of motion back.